Hi, everyone. It's Dr. Ozzy here. Welcome to the More Than a Pretty Face podcast. I'm here to answer all your questions about skin, health, beauty, and wellness, and take you behind the scenes of my practice. If you have any questions you want me to answer, send me a DM on Instagram at Skin by Dr. Ozzy, and I'll be sure to answer them on the show. Now, let's get started. Well, welcome back, guys, to the More Than a Pretty Face podcast. I'm here today, joined by my PA, Eleni. Hi, Eleni.
Hello. Thank you for having me.
This is her first time as co-host on the podcast, so I thought it'd be fun to have her on. She has over 10 years of experience in dermatology, and she is super smart, and she loves natural rejuvenation, which is what we are getting into today. And what that means is using your own body's natural healing powers to stimulate collagen, elastin, firm and smooth the skin, and just overall rejuvenation, but naturally, using your own body's natural powers. I'm so excited about this topic because I feel like we are entering this era of just natural appearances. We see it with a lot of celebrities. You know, it used to be all about filling the cheeks and the lips and, you know, big lashes and all of that. But now I feel like the trend is, swinging the other way. What do you think?
Absolutely. And I love that we can encourage the body to enter into its natural healing abilities with the right products and using things consistently to really encourage that collagen production. And it really is. The things are moving more natural. People want a more natural look. You can see it in the fillers that are coming out that are more of just like the biostimulators and also just like the natural types of neuromodulators as well.
Yeah, because for a while we were seeing, all this distortion of one's natural beauty. But now I think it's just about enhancing your best version. And this is something that as a philosophy I've practiced with over the past 15 years. So it's not really new to my practice, but I am seeing as a more of a general acceptance, I guess I would say.
Yes.
So before we get into it, it's going to be such a good episode. I love this topic. Do you have a beauty and blemish?
Yes. So we'll start with my beauty. I have been in dermatology for over 10 years, but I have just celebrated my year at the practice since I joined. So it's very exciting for me.
She's been amazing. Yes. I mean, Eleni's so smart. She's so good also at medical dermatology. She knows how to treat all kinds of really complex medical derm cases, like with biologics. Sometimes I have to consult her because she does, I don't do a lot of medical derm anymore. My cosmetic practice is so much busier, but you've been a wonderful asset to the practice. So I'm just so excited to celebrate your 1 year. That's super exciting.
Yes, it was really exciting.
So do you have a blemish too? Or?
I do. I accidentally burned my forehead with my curling iron, which I haven't done since high school. I have these little baby hairs that I always deal with, and I got too close and I burned my forehead. So I've been treating that. What are your favorite tips for treating burns on the face?
What's interesting is a lot of people think when they get a burn on their skin, they should put ice on it.
Yeah.
And that is such a common misconception because you're only going to make the burn worse because you already have injured skin and then you're going to apply extreme cold temperature to it. So don't do that, guys. Nope. You can just run it over cold water or you can do some cool compresses, but do not put ice on your burns, okay? Now you can use things like aloe, something light. Use an anti-inflammatory. I love Soothe HC, which has aloe and hydrocortisone, which reduces inflammation. Anytime we can reduce inflammation, especially if you've got darker skin, because a lot of times that inflammation leads to pigmentation. And you can protect it with a skin protectant like Aquaphor or just plain old Vaseline, and really just give it time. Now, if you get a blister, do you pop the blister?
I don't unless it's painful.
Yes, we do not pop blisters because blisters actually act as nature's best dressing for that wound. And if you pop it, you're only going to make that injury deeper and you're going to unroof it, and it's just not going to heal as well. So if you get a burn with a blister, do not pop the blister. Just let it, run its course and heal. And I think a lot of times people don't realize how high functioning our skin is at healing and wounds, which is actually a great segue into our topic today. But yeah, so those are some of the things that I want to bring up because a lot of times I think people have misconception about it. Now, if you are a DIY person, you can use something like honey or yogurt. Those are common, things for DIY things. But yeah.
Do you have any beauty or blemish?
Well, my beauty is, I don't know, maybe it's a blemish too. My daughter got her driver's license
my
this
gosh,
week.
she did. That's
Oh my
exciting.
goodness. I can't believe I have a 16-year-old because I feel like I'm barely 18. So how is that possible exactly? No, but it's great. I mean, she is just, got her first job, was working at like the tennis club, like teaching little kids tennis. And she did this like kind of on her own. Like she filled out the application. She set up the appointment for her driver's test. I'm a proud mom,
Absolutely.
I guess.
She's a go-getter.
She is super independent. And I love that, she can do all these things without my involvement, which
she has a great example. So that's
I don't know if it's by choice or... But nevertheless, I'm just so proud of her, I guess.
Yeah.
And it's really special having a daughter, and that is my beauty.
Absolutely.
Okay, well, let's get into it.
Okay.
What happens to our collagen starting in our mid-20s? Because we're going to talk about a lot of things that we could be doing at home and in the office to stimulate our collagen. But what's a good age to sort of start this?
I think as soon as you're starting to think about it. So in your 20s and 30s, I think it's a great time to start thinking about collagen
at least
production.
protecting your collagen.
Yes.
Because starting in our 20s, we lose 1% of collagen per year. And over time, and this is each year, and if you get a lot of sun exposure, you have a lot of stress, you're, maybe drinking a lot, maybe you're smoking, and all these things that you're doing, that's going to accelerate that 1%, right?
Right.
So what we really want to emphasize in your 20s is protect your collagen.
Right. Let's take it a step back, though. What is collagen and how does it affect our skin?
Yeah, let's talk about that.
Yeah.
So collagen is what gives our skin structure, right? So it's kind of like the scaffold. It's what keeps it firm. But it's not just collagen that we have to focus on. We also have to focus on elastin, which gives our skin that bouncy, elasticity of the skin, right? And then hyaluronic acid is something else that we need to address because that keeps our skin hydrated and plump, and all of these things start to diminish, after our 20s, right?
Yeah. I didn't like the statistic. It's like 1% every year after your mid-20s.
How rude is that?
I know.
That is so rude.
Awful.
So yeah, and then the other thing that happens, like I think as you get into your 30s and your 40s, is our skin gets lazy.
Yeah.
Not only is it producing less collagen, it's not turning over like it used to. It's not retaining moisture like it used to. And of course, throw in hormones on top of that, starting in your 40s and your 50s. And boy, we have some stimulating to do.
Absolutely. We have to wake it up.
Wake it up. We got to get it to stop being so lazy,
right.
Just like
slacking off
with everything else. And that's what natural rejuvenation is all about. Is giving your skin little nudges to rev up production of all these things that it slows down production of, right?
Exactly. Okay, so let's start with the DIY side. What are things that we could be doing at home to increase collagen production?
I love this because that is such an important foundation. And I tell patients, look, you're coming into the office, you're spending all this money, you're doing all these things, but if you are not stepping up your game at home, and boosting collagen at home and doing some of these things that you could be doing, you're not protecting your investment like you should be. You're not going to see as good a results. You're not going to have as good of a long-term result, and maintenance is going to be even harder. It's just not going to be as effective. So I would say my top 3 things is obviously one, sunscreen, right? Sun protection is huge. Even if you're not outdoors all day, just get in the habit of putting on a daily moisturizer that serves as your SPF. I'm super comprehensive, so I use a moisturizer that has SPF in it, but also gives my skin a little coverage, like I have on Hydrotemp BB right now, and it's a 3-in-1 because the other thing is the less things you're putting on your skin, the better it is, because your skin will start to form a memory. And the more inactives that it gets exposed to, the more likely it's going to get sensitized and you're going to have problems down the line. So try to really use comprehensive products. An example being a tinted moisturizer like Hydro Tint BB, which works really well for me. So number one. Then the next thing would be antioxidants, right? Do you have a favorite antioxidant that you like?
Absolutely. I use vitamin C serum every morning. I use the Glow serum.
I love that one because that one has not only vitamin C, but it also has other antioxidants like green tea polyphenols and ergothioneine. So all these things that help boost your repair and protection properties of your skin.
And the vitamin C is that building block for collagen synthesis, which
Yes.
I always love to
So not only is it important for protection, but also it helps stimulate collagen. It's a building block. So those two things, I always put my vitamin C. I use the Glow Serum too under my SPF. And then I love retinoids. Like I've been on retinoids for as long as I can remember, and nothing really is going to stimulate your collagen and your hyaluronic acid. Remember, it's not just about collagen, but it's about these other entities in the skin more than topical retinoids. Right. And I use the Lift and Renew, which is bakuchiol in addition to a retinol. And what I love about it is our studies have shown that actually it stimulates collagen just as good as a prescription, but it's not as irritating. So because of the anti-inflammatory properties of the serum, it tends to be less drying, less peeling. So if you tend to struggle with retinoids, I think that's a good one to start with.
I think that happens a lot with patients. They use it one time and they get really turned off by how irritating it can be. It can be really sensitive to the sun. We have so many options. And we have the over-the-counters can be equally as effective if used consistently and over a longer period of time. We get really great results from those.
And I love that you said that. Consistency, guys. Yes. That is so important because some people will they're like, yeah, I use it, but they'll use it like once a week or like twice a week. That's really not going to do it. You really want to boost that cellular turnover so that your body's making more collagen and hyaluronic acid. If you're just like periodically using it, first of all, you're going to have more side effects. Every time you stimulate that cell turnover, you're going to stop it and you're starting to start all over again. So consistently, and try it for 2 to 3 months. And don't use a lot of other products. This is the thing. We're so overwhelmed by skincare in this country that there's just too much coming at us. And so you really want to just, if you do the bare minimum, just gentle cleanser, boring moisturizer, and your retinoid, you're going to get better results than if you're trying to add on all these other things, right?
And about patience and consistency, as we just discussed, like that's the biggest thing I think for skincare that people really forget.
And I love retinol staging. This is a technique I use and I teach my patients, which is when you cleanse and moisturize early in the evening, so like 5, 6, 7 p.m., and then you wait until bedtime, and that might be 9 p.m., it might be midnight, and that's when you use your retinoid on its own without cleansing, without moisturizing, because you've already done that, and your skin goes into receiving that retinoid in the best shape possible. That moisture barrier is strong and it's going to tolerate the retinoid. So don't give up. And you know what bugs me, honestly, is that there's so many misconceptions about retinoids. Have you heard like you can't use retinoids in the summer? False. You can totally use it in the summer. And the other thing I've heard is people say retinoids thin your skin. Okay, that cannot be further from the truth. There's so much scientific evidence that it actually thickens the dermis, and there's just more data. You can stimulate up to 300% collagen and hyaluronic acid just by using retinoids consistently. Do not underestimate that. That is a huge statistic.
Absolutely. It's one of the most researched molecules that we have in dermatology. It's been studied for over 20 years. Like we have so much great data on it, and it's the best.
Exactly. It is hands down the best. We have the most amazing podcast community, and we want to thank you for being such a loyal listener. To thank you for being a fan of the show, we want to extend 15% off exclusively to podcast listeners. Just use code POD15. This is a special discount we're only giving to our podcast listeners to get 15% off your favorite products at AussieMDSkincare.com. So let's get into natural rejuvenation in the office. What are some of your favorite treatments and procedures to do in the office for patients?
Yeah, so maybe let's start with something smaller like the microneedling. Microneedling is a great way to stimulate collagen. We call it platelet collagen induction therapy. And it's great to kind of cause those little micro traumas on the skin to kind of help stimulate the body's natural
it uses
ability.
these little tiny needles, right? They go in and out of the skin a bunch of times, and that triggers your body's wound healing response, right?
Yeah.
And so walk us through that. What is that like when you do microneedling?
Yeah, so we have patients numb for about 30 minutes.
Yes,
so they don't
pain
feel
is
anything.
always a concern. Everyone asks,
Absolutely.
yes. Otherwise, it would be painful. Guys.
Yes. And it is, these little tiny needles that are going in and out of your skin. So we make sure that patients are very comfortable by numbing them for 30 minutes before. And then we cleanse the skin very thoroughly to make sure that there's no contamination with any bacteria. And then we can use a glide. We can sometimes use something as simple as hyaluronic acid for a great glide. And it also helps penetrate into the skin, into those channels that we're creating. Or my favorite thing to use is actually PRP, which is platelet-rich plasma. And this is our own body's blood byproduct that we use. So we extract the blood just like a simple blood draw. We put it through a centrifuge, and we get that really dewy type of a plasma that's just concentrated with lots of platelets, and it's really great for growth factors and healing the skin after we do microneedling.
What about PRF? Because I think sometimes patients confuse the two. And what's the difference, PRF versus PRP?
Yeah, so PRF is platelet-rich fibrin. And that is going to be a little bit more concentrated in terms of having the fibrin matrix. It has some white blood cells, and it has the anticoagulants. So it's going to really be more concentrated. We think of it as more of like it's going to be for longer term sustainability, whereas the PRP is more for like instant type of healing.
Right. It's like a quick burst, a quick power burst versus a slower release with PRF. But both can be very effective. And not only do we use it when we are, doing the glide and the microneedling procedure, but we also inject it into the skin. And we also do this for hair as well. PRP works great for hair rejuvenation. And the way it works is it keeps your hair follicles in the growing phase, in the anagen phase, longer. Because again, as our bodies get lazier and slower, you may notice your hair doesn't grow as long as you age, and that's because the anagen phase, the growing phase, starts to become shorter and shorter and shorter, and PRP can help keep those hair follicles in that growing stage longer. And that's how it works for hair stimulation, but also all the growth factors that we have in the plasma can really help recruit all the dormant and sleepy hair follicles that are not doing anything.
Right.
And getting them to grow more hair.
Yeah. Really supporting the hair follicles over time. Great for maintenance therapy.
Yes. So what about LED masks? Let's talk about this because I get so many questions on this just from friends, from patients, from, the audience. And what do you think? What are your thoughts on those? You have a lot of patients that use the LED mask, the red LED mask?
Yes, a lot of patients that are using them. I absolutely recommend them. I personally use it.
You do?
I love to recommend them.
Which one do you use?
I use the Omnilux.
Oh, the Omnilux. Yeah, that's a good one.
And I reached out to them. Like, I have a lot of patients asking right when they first started. There's a lot of patients asking about it. I really want to get your guys's, I want to try it out. So they sent me one. And honestly, it's been amazing.
And they have a really good data too. They've done some clinical trials. So they're peer reviewed. And so that is a really a great one to invest in. It can be a little bit pricey.
Absolutely.
But I love the LED mask. I even wear it when I go out to the club.
Yes, I saw that photo. Tell us more about that.
Yeah. Even when I'm out, I wear that. And didn't you say you had a friend that...
Yes, I have a friend. When she'll go out and take her dog for a walk late at night, she like wants to scare people into not bothering her. She'll wear her mask out on her dog walk. I'm like, this is genius.
And you have to do it consistently. We talked about doing retinoids consistently. But if you're not using the LED mask, it's not going to do anything for you.
Right.
It's a great addition to your skincare routine, but you have to do it consistently, at least once a week, ideally 2 or 3 times a week. And you can do things like take your dog for a walk.
I meditate with it. Yeah, it's a 10-minute meditation. It really helps calm my nervous system. I feel great afterwards. But I always have people ask, like, what is the red light mask actually doing?
So let's talk about that. Yeah, what is it doing?
So from my understanding, it is the infrared lights and the red lights are penetrating deep into the skin to get into like rev up the mitochondria, which are going to be those cells that are helping with the fibroblast production and increasing collagen. And it's enough for me to want to use it. And it really, I have already seen great results from it.
Yes, that mitochondrial function is really important, particularly with aging, because it diminishes. And so if you can get it to rev up and help with cellular regeneration, that's one of the ways the LED mask works. Now that's the red light. You can also use the blue light function if you have acne. I know a lot of our patients use it in conjunction to their acne regimen, and that helps with overproduction of oil as well as acne causing bacteria. The blue light does. Now, speaking of mitochondria, you know something else that boosts mitochondrial function that is completely natural? Exercise. When
Absolutely.
you exercise, your muscles actually release these myokines, IL-15, I believe. And they've done studies on this where they've taken samples of skin from people over the age of 40 who exercise regularly. Now, it doesn't have to be, intense exercise. It could just be like 20 minutes, 3 or 4 times a week. And when they look at their skin composition, it's comparable to people in their 20s. So exercise is something you could also be doing at home. Not to get
Absolutely.
sidetracked. I know we already talked about at home things, but don't underestimate that.
Yeah, and I think people are always like, what can I do to improve my crepey skin? That's one of the first things I tell. Get 2 to 3 pound weights that you're just doing. If you're watching TV, start lifting a little bit of weights. That muscle building is really going to help with the skin laxity.
It's so helpful. And if you're listening to this podcast, you could be doing a little workout as you're
Absolutely.
listening to us.
I hope you are.
Just like you're wearing your LED mask when you're taking your dog for a walk or
At the club.
or at the club.
Okay, let's get into laser resurfacing.
My favorite.
Your favorite. Let's talk about it. How does it work?
Well, essentially, laser resurfacing can be ablative versus non-ablative, but in general, it either vaporizes the skin, as in ablative resurfacing, which we are removing small fractions or very superficial parts of the skin, and essentially getting your body to generate new skin. It's almost like how alligators lose their tail; they grow a new one. And we're doing the same thing. So we are removing part of your skin and allowing it to regenerate. Now, non-ablative resurfacing, which has faster healing times, it doesn't have as much downtime, that doesn't actually disrupt the surface of the skin. It uses heat to coagulate the skin and remove it in that fashion. And it's the same thing. It's about getting your body or your skin to regenerate new skin cells that are healthier, smoother, just better quality, that are tighter. And so I love it for texture, for pores, for wrinkles and lines. We also use it for acne scarring. So ideally just using it for remodeling, boosting elasticity. And there's really nothing that does that. You can't really use injections or, Botox isn't really going to do that. So if we're talking about improving skin quality, laser resurfacing is definitely my favorite. Now, there are different types of laser resurfacing, and some are better for dark skin. For example, those that don't use a lot of heat, like the erbium laser is great for darker skin tones. If you have fair skin, really, the world is your oyster.
Yep.
We can use
Got it
anything
all.
on you because that skin isn't as reactive in terms of scarring and pigmentation as darker skin. But I love the profractional laser just as a general resurfacing laser. Great for dark skin. I also love the halo laser.
Same.
It's such a good device. It's so sophisticated. It has 2 lasers in one that goes deep into the skin without affecting the surface to help tighten and remodel the collagen from underneath. And then the second laser in that device is more of an ablative to help with surface smoothing and texture. And so that is one of my favorites.
Really get your bang for your buck on that one.
I agree. And so also, we talk about laser resurfacing, but there are other devices like radio frequency devices, right, that are technically not lasers, but they also use heat to contract the collagen and get your skin to form newer, healthier collagen over time.
Yeah.
And so do you have a favorite for that?
Yeah, I think using the Exelis is our radio frequency ultrasound device that really helps with targeting the skin and heating it in a certain way that's going to help with the skin laxity and helping improve collagen production. But again, this is something that does take time. We need a few treatments on it, and it does take time for that collagen to build. But it's a great non-invasive way. It's like a hot stone massage. I think it's really relaxing. Patients seem to really love the results, but it takes some time to see them.
And I love that it can be any skin type to do it
Yeah.
because it doesn't really target the melanin on the surface of the skin because it works from underneath the skin surface. And it doesn't really matter the time of year because whether you're, you're tan or you're not, and there's no downtime. So now with our busy schedules, particularly in the summer, I find that it's a great option for somebody who's, super busy or outdoors. And I usually recommend you do 4. And we can also do it off the face. So I love it for the eyes and like this area, but we can also do it on the abdomen, the hands. Yeah, so lasers in the summer with the factors of heat and UV, which can negatively impact your healing and your results. You have to be super careful. I prefer the cooler lasers like the erbium, which is like the profractional is a good option. The halo can also be a good option. But you have to be really careful and you got to stay indoors. So it can be a little bit harder to do. Plus people travel, they want to be outdoors and the days are longer. So it can be a little bit more tricky. Not that we can't do it. We can absolutely do it because some people don't mind staying indoors for a period of time.
But also, we have other options too for rejuvenation and kind of stimulating collagen that aren't affected by the sun, like biostimulators.
Yeah, let's talk about that.
Yeah.
Biostimulators, and these are injections that we place into the skin, and they stimulate your fibroblasts to form collagen, and they get your skin cells to produce things that are not getting produced as we age, like elastin and hyaluronic acid and those things. So we have Sculptra is a very common one that people love, and I love it, especially as you get older. In women particularly, the skin starts to get thinner, and by adding collagen to the skin, you can actually thicken that skin a little bit. Not only adding volume and collagen, but also thickening that dermis is helpful.
Yeah.
There's also hyperdilute radiesse, which is calcium hydroxyapatite, and that's been shown to stimulate type 1 and type 3 collagen in the skin. And that one's a little bit trickier, I think, but also a great option. I love it for like the cheeks, the neck, the décolleté, more so than Sculptra off the face. We also use it in the buttock, which we absolutely love. We see great results for that. Not only does it help firm the skin, but it can actually also add volume to that area. So the hands,
non-surgical BBL, we call it.
Yes, non-surgical BBL, and we use it in the hands, and so it's also a great option aside from lasers to stimulate collagen.
Yeah, that you can also do.
And hyperdilute radiesse is calcium hydroxyapatite that's found in your own bones. So going back to that natural rejuvenation, you do have it in your own body. So it's not something we have to test and make sure you're not allergic to it because it's a natural substance found in your own body.
Right.
So what about diet? Because I feel like we talk a lot about procedures and treatments and, skincare, but let's not just skip over lifestyle, particularly what you're putting inside your body, because that is super important.
And it shows up on your skin. What you put in your body shows up on your skin.
It does. So let's talk about that. What are some tips that you have for patients in terms of...
Yes. So first of all, I always tell patients, get some hydration rituals. We want you to be drinking water. Your skin cannot glow if it's dehydrated.
We don't drink enough water.
No, we do not. So that is the big thing. Actually, there was a really funny, I guess it was a reel that came out that was saying, why did people in the 80s that were like, they looked younger, like people in the Golden Girls, they were like in their 50s and they look so much older than people now in their 40s and 50s.
Yes.
And they think it's because of water. We're just encouraging people to drink so much more water. That's not the basis of it. I'm sure there's a lot more, but that's, I think, a big deal. We just are drinking a lot more water, encouraging people to drink water. It's the first thing I do in the morning is I drink my warm lemon water.
People just don't like water. A lot of times it's like doesn't have a flavor. So I like putting like a little lemon in mine and a little mint. That can make you want to drink it.
Absolutely.
Or sparkling like mineral-based water, which is a great source for magnesium, calcium carbonate, and some minerals. So whatever it takes.
Drink the water.
Drink the water.
Yes. And if your skin is more dry, we tell patients use some electrolytes. Maybe put a little salt in your water. It really helps with the skin dryness as well. So yes, the water is the main one. And then, in terms of diet, I always tell patients to like really kind of have more varied food. People kind of tend to eat the same things all the time.
That is
true. So eating foods that are high in antioxidants,
berries. I love berries.
Love berries. Omega omega-3s, shellfish, like
Salmon,
tunas. Yes,
yeah.
lots of those fatty foods.
Avocados, yes.
Absolutely.
And it has a good fiber too. Yeah.
Yeah, things that are rich in zinc too. I think people always forget about seeds, and flax seeds and pumpkin seeds are really great for your skin. So,
And I want to just say that we are so supplement obsessed in this country. Instead of getting our natural nutrients from foods, we're really relying on supplements,
Absolutely.
which has gone crazy. I think it's a multi-billion-dollar industry. And I always like kind of raise my eyebrows
yeah,
when
it doesn't
comes
have to be
this.
FDA approved.
It doesn't have to be FDA approved. Actually, I just read an article that we're seeing more and more liver damage because
Yeah.
people are popping supplements like it's just going out of style and it's candy. And the other day I had a nephrologist who was a patient of mine, and she was talking about creatinine and how people creatinine. I'm sorry, creatinine, which can worsen your creatinine.
Yeah.
Creatinine, which is a function of kidneys, and it can be affected by creatine, which is a supplement that a lot of people take now, which I get it. It has shown a lot of benefits. It's been a lot of long-standing trials about how it's good for cognitive function, muscle building, especially in women as we get older. But I think you can overdo it.
Absolutely.
And so just be really cautious about all these supplements you're taking because you never know how it interacts with your body, your medications. These are not regulated. And it sounds amazing, right? Oh yeah, take this and take that, and let's back up and pause a little bit. Maybe we should be getting some of these nutrients from real food in our diet.
Whole real foods.
It's kind of like the Jetsons, back in the day. You ever watched the Jetsons cartoon where now instead of eating, they just take a pill?
Yeah, right. Exactly. Yeah.
Are we heading there?
Oh gosh, I hope not.
Well, our liver and our kidneys may not be too happy about that. All right, guys. Well, this was such a fun
this was so
episode.
fun.
I hope that it was valuable. And we love your listenership and subscriptionship. And if you found this helpful, share this with a friend because sharing is caring. Thank you so much for your support and tuning in. We do this podcast because of you guys. We are so grateful for the community that we've built. Until next time, bye guys.
Bye, guys.
Thank you.